Nunavut Blackwood Chapapi Ublak Takwa Nunavut Luani 11 Kolilu Atau Herlumi Ami Hungarer to Numantang Yakak to Nunavut Luani Arveni 8 Iqaluit Tikar Rami Pingahuni Nunavut Luani Mana 153 Takwa Numantang Yakak Amatakwa Katilukta Luit Akawi Hakto Himayo Nunavut Luani Nubanagwa Mikanu 4,712. Amaman Motikid Lu Hulitakwa 813 Malikta Yakawi Hakto Nubanagwa Hangi Mangata. Man Hanata Liata Nunavut Luani Upka Himalerapta Imaka Ilangi Humatakutana. Hundak padlengi me manuban na houting it taimo matahuli o kauti u lota pitanau takwa nokkangana me ai hemana me takwa ikayoktu yang itu waluilen ikayoktu tana nokkai badle yok nuban naryong mi amma kawi mayu tata an akko nato ayong natu ya takwa ublung iluni ai himamalo ni Takwa Nunu no Haujuataka Tan Akko Tigimalu Tan Mana Ngituku Ikpakagut Nangito Tana Nokaina Rapti Numan Narya Takwa Malakatalu Imaka Taki Luni Panik Patatan Nuban Narya Mixi Badla Rayan Naman Tamap to Lukta Ikayokati Luta Tamap to Lukta Madik Lutatako Koyo Yutan Haligana to Nuban Narya Matay kwa ay himamaya tut pilaring itu matna papi udalung itu matna papi matay kwa angayo ka ay himayut linya tu tingin utarangin nit ikayok tut matna papi matay kwa pilariya kadata tut pilariya huli ublutama pilariya tak tut matna papi pitao pilariya narapi matay kwa government kuno pilariyut amaan yakak tailitit signo pilariyut akroin nakso di pilariyut ilang inuitang itu pilariyut matna papi matna ko makihim tayo matutak man kau yung mayong taan na nuban na kaya takanak tu ya ilang itakayu yuli tuhang yuli nuban na kaya mi tabanin nubu iluani kiheni taan na abung kayu hiu ya lu taan na kiheni halagi niarap tu nuban na kaya matna ko amir tunga kawi mamasung nubu nala chata mata na halagi niarap tu nuban na kaya Ugdumiyong ito, akagong ito, kihani halagi niya ito, nunabumiyo matna kimat sema punga nunabumiyo matna. Good morning. Today, Nunavut has 11 new cases of COVID-19. There are 8 additional cases in Arviat and 3 new cases in Well Cove. Nunavut now has a total of 153 active cases of COVID-19. The total number of persons followed to date is 4,712, and there are currently 813 persons being followed. We are now 1 week into our stricter public health measures. Sometimes it may seem like you're not making a difference, but I can assure you that all of your efforts and hard work are helping. We need everyone to stay strong and dig deep. We're in this for the long run, and we need each other and every person doing their part to fight COVID-19 in Nunavut. To every person staying home instead of visiting, thank you. To every parent working from home and balancing remote learning with their kids, thank you. To every essential worker showing up and providing your critical services every day, thank you. To every health and government worker, whether you're on the front lines or behind the scenes, I thank you. To each and every one of you doing your part to help your community, I thank you too. I know this virus can be disheartening and draining, but we can do this, and I know we can, and we will. I want everyone to stay well, stay safe, and stay home. Thank you.
Glasses and masks don't always mix. Sorry. Good morning. Today I would like to talk a bit more about testing. Testing is not a magical solution and it is not effective by itself. Contact tracing, isolating, observing physical distancing, and following public health measures work together to contain and stop the spread of COVID-19. When someone is exposed to COVID-19, the virus begins what is known as the incubation period, meaning it is growing inside the body. In these first few days of this growing or incubation stage, the virus is very hard to detect. During these first days after exposure to the virus, the majority of tests will be false negatives.
Inu khatigi khanigi lo tele khatarningit mali khatarner lo anne khanangit tulerang isulit malitau ya haktitaw yoni tamakko katilugit tamakko ser mateli kutaw gunak tunuva joanak 19 mi kinatuinak ima katisi yumini utilugu nuva joanak 19 mi tana pero palle sa khatarto timimi timit sinni tana ulug ni pigeli khatar tilugu tana pero palle tilugu tana Nuvat joanak ayong nakatakto kawiyaw gaswara nga kawiyaw tinun. Tako sibulak pangin ni ulungin ni katisi yumini uyok tilugu nuvat joanak mig amisui tako kawi sakuti uyu tamma katakto nuvat joanak kang ningin nakaktaw lutik. Nuvat joanak hakalawak tilugin.
Without knowing when every individual we test was exposed to the virus, we would have to test everyone multiple times over multiple days. Doing this will deplete resources and testing materials with very little success. False negatives are one of the reasons why mass testing is not the most productive strategy in our efforts to identify and track an outbreak. On the day after exposure to COVID, testing is almost always negative. Although test reliability improves steadily as the days pass, testing does not replace isolation. Again, we would need to know the exact timeline of exposure of the people we test to ensure that we are testing them at the appropriate time. Testing is not perfect, and that is why combining testing with contact tracing and isolation is the most effective way to contain an outbreak and stop the transmission of this virus.
Kaya mangitluta hangakut kinatuin na kaya sang natabot katiyak tumini mga nuwadyanak tulimik. Kikulima kaya sa kataraya kakayak tava miswakti ulo kasarning. Dahil may liurlo tatako nungu sa tuin na kayak tabot atuti kalakit pipilirit jutit sabot kaya sa kutivulo kayo sitsa kutawngit sa makiluting. Tako tamma khatak to khawi sa kuti uyo ilang apidjuta vusum mamis yun khawi sa khatak nit atu te khalwangin ninganik at suru te kharnitin no khawi sa kaswak tiluta na lunay yay tiluta taman na sayang mapalya ni uyumin. Tana nuwadjuan na mukati siyo kakto miniu tilugu khawi sa nik taman na tamay na khatalangayo nuwadjuan na khangin ni kaktaulo ni khawi sa kutikko. Tatko khawi sa kuti uyo tako piu sibalya khat Tagalog tilugi uloy na valya tilugit kaya sa katang tan kingubigon nang imani taylitit sinaming ukaw sa kakanero mayo atako kaya malatara kakatahangak ko katisi yumini mga atako nga kaya sa nakatatinig tako kaya sa tabot sulo uloy saban kangilaw tilugi kinguneagulo ni kaya sa katara kakatigo kaya sa katang tamay na Tamang itungin na katadjangin matay may mat. Katitaw si maluti kawya sa katang na kamalo katiyaw si mayunik kawya sa katang na anitaylitit sinaglutana. Atuti kat siya nakpangubok siya mataylitit sinang nukangatit sinang mulo siya magunang ninganik no batsuang na.
Contact tracers are trained to be able to determine who the best candidates for testing are and when testing will be most effective. I need to emphasize that although the term contact tracer might be new to many in the public, It isn't a new practice in the health system. We have used contact tracing methods for years to help respond to infections ranging from tuberculosis to sexually transmitted infections. Our health teams are skilled and working very hard to help break transmission of this virus. In closing, I want to take a moment and thank all the essential workers who are ensuring services in our communities continue, particularly in communities affected by COVID-19. I also want to reassure you by saying that if you take the necessary precautions, wear a mask, observe physical distancing when possible, then you are doing what is needed to reduce the risk to yourself, your family, and your community. Thank you.
Tamakua katiyaw yung minarnik hawi sa kataktot pilim masayaw si matsayakto naluna sigun na nang kikut hawi saktaw gaya kang mga ta ambalo hangakut hawi saktaw gaya mga ta naluna siga ka mayong atakwa nutango galwak tilugo katiyaw yung minarnik hawi sa kataknak amisunut taigo siw ni nga kisani ta nutangong ito taman na anahan ng itulirin ng mon. Takwa katiyaw si mayunik hawi sa katak si mayugak kago kasalong nik solo siyang masuno hawi sa tuta puvalo namik singin nila kuyan nikut takwa anya nik siyang maktaw suning. Takwa anahan ng itulirin ng mo piliriyivot piyon ng nakat siya tut at sarudi at siya sutilo taman na siyang mapalyanik nakatitaw hulugo. Piyari rutigi lugo kau sa kakain na kamayong akuyan na may lugita ko ikanayan na realit. Tamakwa piit sa kauti nunalin ni kayo sigun na kulugin. Piluak tumi nunalin na tuktaw si mayunin o wadyoan na 19 mun. Dalo na bigi gumapat si takwa kanoy liyo kutisi o jaksut siya kutisi at malitawin na kulugit. Matuwa si may narlusi. Inukatit sinnekanip sa lote ilakat taklusi. Takwa ilin na ulo kaya naktumitit tayo gun na kulutit ilanik nunakatin nilo. O yan no may.
Ken Driscoll, APTN National News. Dr. Patterson, are there any Nunavut who are in the travel hubs or in a medical facility in the south who have tested positive for COVID-19?
Ken Driscoll, APTN kun niluta Patterson Nunavut ni ablak sa mayuni anak bilak sa mayuni ubalon ni nalo na tao sa kasamabano ba diyan nak to karangin ni?
Yes.
How many and from where?
Hatsit ang malo nami.
I'm not sure of the exact number, and I don't know exactly where they're from because of where they caught it. Most of them are being attributed, all of them are being attributed to their, to the jurisdiction that they're reporting in. Off the top of my head, I think they are all in Manitoba.
Kaya mangitong katsilatang mga ta, namimiw tao mga talunid. Takwa kisani, nalo na tao katang ningin upadyan nakto kam ningin utay ka na avitok si mabiyo yun ni inigiyangin nalo na tao si katang kata. Takwa ilo na timani tao ba may palay yoy.
In those cases, we're working with the local health authorities to maintain and support isolation, and they'll be able to return when that's finished so that they're no longer infectious by the time they return to Nunavut.
Tako nalo na tao sa medyo tako pili hati kiyabuan na nang itulir yingyas dahil kani awitok si mabiyo yun tako sa maktit si tayo hulugit ang maloy kayok tao hulugyan ni tayo tilugit utiron na sila ang atas sa maktit si katakon na ilipatan Nunavut mo.
The Yukon has recently switched to mandatory masks indoors. Have you given any thought to doing that here in Nunavut?
Yukon miligo tako sa ego bakang ito may isak si mani ato ako ti matuwak si makatako yilang ata taman na isa matsaksi ako tigis si mabiyo.
Thought about it. The feedback we're getting from the communities is that right now most people are wearing masks, and the effort to enforce and get that last percentage wearing masks is probably not worth it, and many of them probably have other issues that they like claustrophobia or breathing issues where wearing a mask is maybe not appropriate. And the other bit of feedback is that in some communities where stores have made it mandatory, people are having difficulty accessing masks, and it's becoming a barrier for them to get food and other essential supplies. So right now it doesn't seem appropriate to make masks mandatory across the territory.
Tamanay sa mag-isama yakalawa to sa katak sa magatalo no nalinay tamakko matuak sa makatak to namin sa unik site tako kasi nilo nati tema ilangin matuak sa magiangas account sa katangin matasulo ijanguli sa ngulutik ipinali sa ngulutilo ni matuak sa matuakay gumi to sa malo talo ni uwek bin ni tamakko adjiging ito ni ilanikot ni uwek bin ni tako matuak sa may nakakatitaw tilugid ilang ato yung nakakatangin mata matuarnik taman na bearo ti ulit yung nakakakayangay manikitara to kung nang ninginik manaw yung taman na sa agor bekangilo ni Nunavut may malitaw kadyangi kay naktara.
Jackie McKay, CBC News. To follow up on Kent's question, if you test positive for COVID down south, what's the process for Nunavut residents? Do they have to be negative before they can return to the territory?
Jackie McKay, CBC, kung nikan apik tiga katakta nga tamakwa kaya saktaw kataktuit nalaw na tayo patanuwad dya nakakninga ni kakwa utirun na sa katakanuwad dya naktaharun ni kay matakisani.
They'd have to be cleared by the local health authority under their, it's in their jurisdiction. I don't think, for people who are outside of the hospital, I don't think there's any jurisdiction in Canada that is still relying on repeat testing. It's 10 days after the positive swab or after the infection started, and at least 24 hours free of symptoms.
Tako nalo na ito kak sa mareali tay ko na niya bitok sa mabiyo ni ana kan nang ituliri nginot tama no vadjak nakto karon ni naktaw lutik kisa nilo na tirawi saktaw katangin mata ana balo mingang ito arutik tay makawi sa lakitaw katangitut kisa ni ullo huli na lawak tilugo kawi sa kutinga nalo na tamin ni utilugo ubalo kanoy ko tikak palaya mini utilugo tay mautiron naksisu ngujut amalo ullo ni ila ikakani 24 ni kanoy ko tikalaw ngit salag lo ni tay manalo na taw gun nakuno wadja nakto karon ni tamin ni ngani.
My next question is for the Premier. With schools being shut down, food programs have also shut down. Last lockdown, we saw private citizens take it upon themselves. We've seen the mines help out for some communities, but not all communities have that sort of luxury. Why hasn't the GN put any food programs in place to ensure that people who rely on school food programs have them this lockdown?
Tako ilin na be matusima tilugi tako tao neritit siguta watu matusima katame mata atu inaugun nersutig kisani ilang inu katigi kayo katakto galo neriyat sani atu inautit sigar sutig kisani tay may tu inaung matanula rin so manuna buka vumakung itamakung atu inautit singila matusima lak tilugin.
I believe we're working with the affected communities more so than generally all of Nunavut here. The lockdown is we're 1 week done and one more week to go, and we don't want anyone to go hungry, but we're still working on it. Maanaw yung tako government could pila katakang nakhawi tako at nunalit nuban na yung akaktuni. Tana ukwa kimane ilin na awing hunaluk tana hanatali ataw ukwa kimalosol ya mahanatali ataw hikana ukwa kimane na lason tako bila kati ke kini me ta ko no ta ka le ka kung ma ti ko bila kati ke lo ta ko ta ko.
The Canadian Press, Dr. Patterson, please. So we know today there's 115 people who have tested positive in Arviat. How many people in total, including that number, are in isolation right now?
Emma Tranter, Canadian Press Kun, how you maligata 115 ulang ningin ni Arviani, Hatsi Takunanga, Aniteli Titauban.
I can't remember the exact number, but I think it's definitely over 300.
Kamang ito Hatsi Latang mga takasani 300 ungatanito.
Just to follow up on Jackie's and Kent's question earlier about people testing positive in the south, if someone is down south for medical, tests positive, where would they go? Would they go into the isolation hub?
Apiriga kanaluna pikutu katartunita ko how you sakta you naluna tao patino wajak makarningin ni kaluna ni tilugi. Namong makatakha anit daily winno to yung mi winno katakhan.
It depends on the circumstances. Some have isolated at their own hotel, some have isolated in a family house, some have isolated in the hospital, and some have isolated in one of our isolation hubs. The one place that we have not let anybody positive with COVID-19, I'm going to back up on that one, sorry. No one who's been positive for COVID-19 has isolated in any of our boarding homes. Sorry for the poor wording on that one.
Taman najigi katangito ta ko kanilingan ni malitu kita ko aniteli titaw katakto naminito yung mivingin ni ubalo ilangin ni taw na nakalonani ubalo aner balon ni ubalo ni ta ko na nito yung mivin ni aniteli view titaw yun ni ta ko nalona taw si mayuno vadjo naktuli ta ko nung aner belar si mayuno to yung mivingin no tay kaniti taw katangituin.
Megan Dooling, Nunavut News. Can you say what the GN is doing? How are you working with the government of Manitoba to provide support for Nunavut who have tested positive and to make sure they're okay? What specifically are you doing to monitor that?
Megan Dooling, Nunavut News. Nunavut government kung Manitoba government kung Hanoi kayong mga tatamak ko nga naluna tao si mayunin no vadyo ang naktoham nga nindaluna sila taon na hanoi kayong tao katak mga ta.
For the people on medical travel, the Iqaluit services are checking in with the people on a regular basis and providing support that way.
Tako nga nabilang si mayunin ang muta ko kivalek Inuit pizza kartik kung ikaw yiga katak to.
And when, sorry, I was just going to say, when someone is in the south and reports Nunavut as their home jurisdiction, the jurisdiction where they're diagnosed notifies us.
Tako kinatuin na Nunavut miu tao yung tao na ni sulo kalunani naluna tao na kanawad nak takamingan ni tay ko awitok sa mabiyo yung vago uwatin ni kao yung kaya katak to tayo manaluna tao yung kaksimaningan ni nuwad nak takumi.
And depending upon the circumstances, then that jurisdiction will provide their own follow-up as well.
So
if someone were in tough circumstances, you wouldn't necessarily know about it?
Sorry, say that again?
If somebody were in tough circumstances, you wouldn't necessarily know about it?
If they didn't identify as a resident of Nunavut or didn't contact us, then no, we wouldn't know about it.
My next question, I think, is probably for the Premier. What specifically has the government of Nunavut done for communities who have been infected? You've been talking about how you're working with them to help, but since they've gone into lockdown, what have you done specifically to make sure that people aren't hungry?
Ukausa khatta be pili khati ni rasoti ta ko matuyaw law tilugi ta ko kanilo khatta kisita makko kale khunagi.
Income support department is working with the income support clients to make sure that they can get their food or a check deposited to the stores that of their choice, so they can make sure that they can get food. They can't come into the office because there's lockdowns in government offices there, so they're using phones and other means to make sure that no one falls between the cracks. Takon nakaito hoktut pilakatigi yabut nakaito tsi kunit talapotikut ubaluba kanumeo takwa titira mukaini ayong mata amak check mikina kamera iksan ayong mata tanago kino niwe agjak tauluni taking nakita tu doayak.
Trevor Wright, Nunavut News. My questions are probably for the Dr. Patterson. This probably has been asked before, but how has overcrowded housing contributed to spread in these communities?
Tana Trevor Wright, Nunavut News kunik tako apiri tako kanu atu la pipale ko si mga tako ilumio katigi ami solo hatta tilugit sama palego taw mga tako na ninunalini.
It's a major factor. It's probably one of the bigger contributors to the spread.
Tana piluang nakpa ko taw yu tana sama palego taw lakin nakpa ami solo hatta tilugit ilumio katigi.
Do you have any advice for individuals in these overcrowded houses, or?
Yeah, it's important to remember that yes, overcrowding contributes to risk and certainly aggravates the problem, but that doesn't mean that simple things like washing hands, wearing masks when appropriate, and regular cleaning of high-touch surfaces, those still have an impact, and we do see some houses that are overcrowded, but there's very little transmission happening between individuals.
Kiseni tau tana nukhangati tau gunnak me yosurlo ko malit tau sarlo ti aggamin ni wasa inna khatarlotik matuaksi makhatarlotik salum maksay khatarlotik tamakuning atok tau gayon nakpami ta ko apimare buta ko ilani kwala amisu galo aktilugi ilumi khatigi taman nasyak mapalle khatangin medyo ilangin ni.
Kent Driscoll, EPTN National News. Dr. Patterson, our Selderin medical partners, many of them are in regions that are getting very hard hit by COVID-19. At what point does that start to impact the government of Nunavut's ability to send people to those facilities, whether it be for COVID or anything else?
Kent Driscoll, EPTN kunigluta Patterson tako kallunani piliriyo katibut ane akarnang itulirinang imasang makpalle gutaw lagi ngata. Hanu taman Nunavut matu ni aka Nunavut 19 hanu pizza begunang netino taunani.
Not to be flippant, but when they tell us. And so what's happening with that is Dr. Francois Devet, Territorial Chief of Staff, is in regular contact with his counterparts in the southern jurisdictions that we refer patients to. And he's keeping tabs on the availability of beds in hospitals in Winnipeg, Ottawa, and Edmonton and Yellowknife. And I'll let Uli interpret that part.
Kiulata tuina keinalugu oha jogut taha yilaktugu. Kisanita na luta Francois Duveta nangi yokaya yuluta no tamani Nunavummi. Khoy sakpalangin nakto kallunani piliri khatiminita kwa inikhat selik palleani agalwa mangata. Takuna ni pilongo atumi Winnipeg mi Ottawa mi Edmonton mi Yellowknife mil.
And so Dr. Devet will alert the community physicians and work out alternative plans for people if a regular referral center can no longer take our patients.
Tani la luta Devet how yikai gayak tununalin ni luta ngoyonik takwa aulak titsibiu watu ini karuni ni kata asa nungak tau ga halang ni kata nunalek nun.
Dr. Patterson, there's certain types of jobs where the people who do them, by the nature of the job, have to go into many residences, building maintainers, rental agencies, Northwest Tel. But masks aren't necessarily mandatory throughout Nunavut. I'm wondering, do you have any specific advice for people who have to attend multiple residences in a day as a part of their job, as far as their safety?
Dr. Patterson, tako ilang ikanayat. Ang ikakayaw yun, isirea kakayong mata, sulo tamakwa ilunisa nagyaktit, ubalo atuktuak tuliriyit, ubalo tamakwa ikuhalaw sa kiyik ko Northwest Telkod. Taman na matuwak sa magyakam na si ago bikang ito may malitaw gato tinago kanukaw jiga kayak kita kung ikanayak tino. Ang ikakayaw yun, isikatak tuno, ulo kaya naktimay tailitit sinak.
Well, my recommendation to them would be that they should be wearing a mask when they're doing things like that. They should also ensure that they're following Worker Safety and Compensation Commission guidelines because they have authority over those as workplaces as well.
Atulay ko jigayak tong alitay mata ko matuwak si makatakulogi ang ikakayaw yun isok na ito kay pata. Naluna tao si malutilita ko kanayak tinunaliw ko maligayik ko ato agang ini malit siya lutitay ko sangin nakakti mata kanayak biyo yun eh.
Jackie McKay, CBC News. Dr. Patterson, can you explain more on what constitutes community transmission? We're seeing cases go up in Rankin and Whale Cove, but we seem not to be qualifying that as community transmission.
Jackie McKay, CBC, kung nakausa ka kung nakikano nalunang sa katang mga pinunalin ng sa mapalayo kalang ninganik. Tayo mga nalunang sa mangin na biyo kang sinang mitikirak djamilo kasi ni Arviat tayo mga nalunang tao sa mamanunalin na sa mapalayo ninganik.
Community transmission refers to people catching COVID-19 when we weren't even aware that they were exposed or a contact. So if we've identified in a community 5 households and we know that there's at least one person in each of those 5 households with COVID-19 and we've figured out all of their contacts and then all of a sudden somebody shows up who's symptomatic and has COVID-19 but was not on the contact list and not in any of the known households, then we get concerned about COVID, community transmission.
Taman nunalin ni siya mapalaya na kaktaw katak to tamak ko sulo nuvat juan nakta nakata na mga kawi manatik nuvat juan naktulim mikati si juminiugi ang inik tako sulo tan lima patay lumio katigit ataw sito atan na nuvat juan nakto kakka tako na ni ato ni lumio katigi ni kawi magun nakto tayo mga tako na nga tabanit sa sang mangninganing kasi ni tako kawi ni rutata katiyaw yung miniungit tumik tako nung nupadyoan nakta sa mayuno tayo ma sila tayo tako ay lumiyo katigi tayo makaway malagayak hugo tako nunalin ni siyang mapalyanin.
In the case of Rankin Inlet and Whale Cove, the teams report that they haven't had any events like that.
Tusak sa magatakang sinang may tikirak jo amilo tako kaway lang ng matago tayo manunalin ni siyang mapalyayo hamningin ni mau natuin na.
Is the GN still making exemptions for people not to isolate to come into the territory?
Nunavut makung isuli ang ikatak kuningan inutukay na tayo gatong ito ni takot ikanaya reakto ni tamawan Nunavut mo.
Yes.
Emma Tranter, the Canadian Press. I asked earlier how many people are in isolation in Arviat. Can you give us those numbers for Rankin Inlet and Whale Cove?
Emma Tranter, Canadian Press. Kung napirika makatsi mga ta aniteli titaw yak vani. Katsi wali kang sinang mitikirak jamilo.
No, sorry, I can't, and we can get them to you later. I can't remember what they are, and I would be guessing.
Aga, siya ko kahit sigum na lang yung nalaw sa tuwin na kaya kama kasi ni ukaw tigun na ilaw ukaw jagun na lang ayo tisa.
Can you kind of walk us through what the rapid response teams do to ensure people are isolating if there's over 300-ish people isolated in Arviat. That's a lot of people to keep track of.
Tako tawin naktukku ikajoreartiu vattu hanuiliu hattaqatamakku anitteili titoyo anitteili lattaaqalua mangato haqqaugavi 300 ungataani innerarsigaarvian anitteili gaali hanu hauyissartau hattaqamalitssaaqalua mangata.
The teams are in either face-to-face or by phone in regular contact with everybody who's a positive case, people who are who are known contacts but not positive. I can't remember how frequently they're advised or how frequently we're in contact with them. It varies a bit depending upon resources and how easy it is to get a hold of them. But they're reminded on a regular basis every few days about needing to stay in isolation.
Tako tawin naktulirin mo piliriyo hatigit ima katisilata hataktu tako ninga iqaitit siga hataksutik ubaluni ukhalaw tikku tamakku ninga nuwadjuan naktarsimayunik tako ali khawya majaw katisiyuminiu yut kisiani nuwadjuan naktuhangittu iqhamangittu hanutigi khawi kakaqtaw hattamangatak ambalo hanutigi khawi kaktaw gunna mangato khalaw tikhangikku tilluni tamanayong nakhattamimma Megan
Dooling, Nunatsiaq News. Are you using charter flights to get swabs from Arviat and Whale Cove, and where are they being sent to be tested?
Tako tanna Megan Dooling Nunatsiaq kunnik tako hangata titayuni hangata yuni aulatit ila hayisaktagu titsani hangata yuku tikitit ila aitse hatta kharbani tikar jamilo.
Yes, it's part of the charter project that we started in the summer, and they're going either to Rankin Inlet or Iqaluit.
Tamanna ayak pigertaw to charter ko hangata titaw ko ayak kangak sinagmoktaw hatakto ikalunnulo tamakko kawisaktaw gyali.
Initially, when positive cases were announced in Whale Cove, they were being checked in on public health staff virtually. Is that still the case, or is there a rapid response team on the ground in Whale Cove now?
Pigat ko tatillugo tamakko no wadjuan naktak pallialaqtillugi tikirarjuami ukhalaw tikku rubbaluni harisayak ko khawigiartaw hattalaungata tavani tikit tuqarsimalaqqa tikirarjuamu ikayuriartarsimayuni tuavernartukku.
I think there's one person in town or who was in town for a bit, but much of that work is being done by the telephone work is being done by people in the virtual public health program.
Tana tau se tai ko ngati kisima kay na lawak tu galawa kisani tamakko khalaw tikku pilirilo ang waktu ana hanang itulirin ang mutako khalaw yo khatakto man na yo khalaw tin nakku ikayok taw yo.
Previously, you mentioned people could choose to stay longer in the travel hubs if they wanted to. How many people have decided to stay longer for cases to go down? Or
you forgot to say your name.
Oh, Trevor Wright, Nunavut News.
Trevor Wright, Nunavut News. Kung niko kakagabita ko ilangit. Ako niyo naksakan lunani kay narunang naraksugit utir na sa kay narluti hatsi bata ko nirwaks mayo. Ako niyo naksakan lunani kay narang.
There's one person in one hub who is waiting to go home.
Ataw sito ata na tuyong mi view ni no tu view ni ang utak kayo ang ikak nasakay naktis si mayo.
Has there been any discussion around the Churchill travel area or any changes, possible upcoming changes around that? Or?
Tako kasi si mabatay kaniko jara lo mi Churchill mi aulak beo katakon na mga balutaman na sidyak taw si mabakano.
No, there's no cases of COVID-19 in Churchill right now, so closing that common travel area would not do us any good. It is a site for recurrent dental treatment, and there are some children who would be going there next week, I think, to access dental services, so that will continue, at least from the communities that don't have any COVID in the community right now.
Aga. Tako ano ba dyan naktuhangin mataw na ni kutsa kalo may church me matuyaw pa awla pigun na ni ngatu te kakayang itsiyang ngatan na kikutili review gak to katangat tako alo suko sila taw nung ngaw jaw lalang may mata pinasa ako si ulak to me kikutili review gak to luti kasi ani tako nang nga dyan ito nunalin nino ba dyan naktutak sa mayunin.
Kent Driscoll, APTN National News. It's been some days since there's been a new case in Savikataaq. Can you sort of take us through how the restrictions will scale down there? What can Savikataaq expect in the upcoming days and weeks as far as the lessening of restrictions?
Kent Driscoll, APTN kun ni ulugalaw sa malang katatako sa Savikataaq nuwadyo nakto kalaw kun nertilugwi. Kano tako how jaw gun nakasani kilo me ulu galaw na akto ni pinaswa ko si galaw na akto ni tako kasi yaw wala na mga ta malitaw gaya akto.
The schools, once the last person is out of isolation, the schools would go to their stage 2 in their opening plan, and the public health measures, the place on Nunavut's path would be pretty much where we were in July.
Tako ilin na bit tan naking ulak pa sulo ani teli ga hakti tayo piya ga katako ninga ulungin ni tako ilin na bit hutin ninga makumo matuyok palagun excuse me matuyok palagun naksiga yakto tako alo ane hamnang itulirin mo malitaw ga lino na vo matuyok palaning ino tay matsay na te kun naksila to July mitay may yugatani.
There are still Nunavut who are planning to travel south for pleasure or to visit family over the holidays. Are you reconsidering anything with the travel hubs in light of these, any changes to the travel hubs in light of these positive cases?
Nunavut pamasim mata ilang ikanlo na wala nang minik ima isumay nakigayatong lupi hikak na ulit kat. Tako asid isumagayaw sumaba asid jak taw na mga tati yung review yun ito kay nakbiugali tama Nunavut.
Well, first, sorry, Uli. First off, we continue to recommend that non-essential travel be postponed, especially as cases rise, and best expectation is that they'll continue to rise for at least a few more weeks.
Siguro pa mi tako hauserin na hatak sumayaw pimareung ito ni pidso te harlo te awla hatak yung ikay nakatatako amisong pala tilugit ni reo nang atako sula amisong pala ni ang tapi nasa ako si galaw ni akto ni.
In terms of the hubs themselves, no major changes, and we've tightened up the maybe not tightened up, but we've reinforced the need to maintain distancing and other public health measures within the hubs themselves. It's important to remember that people go there as a means to isolate. Just being in the hub itself is not isolation.
Tako ngila no to view hatak to yung mi vi no to kay nakbiu hat la si jekto yo luak to khajang ito kasi ani nalo na sigar sa mayugo tako malit san la riga halang ningin no khatigi kanigilo tele hatarlotik. And we
have the review work happening to see what can be done, what else could be done to improve the protective effect of the hubs, and they're looking at everything from altering policies and procedures to working with advice from the National Microbiology Lab and others to consider testing as appropriate in the hubs.
Ay sakta wala medyo kano tako pius balak taw kun na mga sa pumiyaw siya kun nakkanak nakahulugit sulo sa jak taw lo tiato agang imalit taw gali tanalo kana tami ang CV khaw isak bedjo atay na khaw isak Palea me yo ta ko how you sakta sin na khatare hang na mga ta to yo me bin ni to ani tailo yo ni.
Jackie McKay, CBC News. This question comes from a resident in Arviat. For those people who are in Arviat but have homes down south, are they able to return home down south at this time?
Jackie McKay, CBC, kung nita napikuti yo ak vea mi ngak to nita ko ak vea mi wang ikali halunano tikun nalakan.
Yes, they do need to contact CPHO travel requests, and when we get those requests, we review to make sure they're not somebody who's identified as a contact or a case, and as long as once we verified that, then they're allowed to travel. I get the letter fairly straightforward that way.
Tako tutsa rele tako nunga khariso ya kutsa be khatak temo awla ko mayo no tutsa rauti ila tutsa be yemo khimek ko yaw ga yaktok kati yaw simangito akhat balono vadjo nak to hangito akhat awla ko na ga yaktok tutik khataks maloni.
Caribou Cabs has said they're closing from midnight till 5 a.m. starting Thursday for a collaboration with the GN. Can you explain what that is?
Tako Caribou Cabs taxi tik go mato katalalang nga taon no may 12 make 5 mula mo no government kunni tayo mga pili kati simaniraks sa tiyo.
My understanding is with the current public health measures, their business after midnight is very much has dropped off a lot to the point where it's almost unprofitable to stay on the road.
Tukisi mayak kumana yok ta ko pidyo tigil lugan na mangituloy na mo malitaw galit unno ako hulani kinguni agot piyat sa hakon ni siya katang at tayo maki na yali katang na limata tayo mamato sa kaya katalangan ni kakton.
But they've been in contact with the Department of Economic Development and Tourism and others to keep a service available to essential workers, especially for on-call staff for QGH and others, so that after-hours lab services and things like that won't be disrupted or delayed.
Kasi ni gota ko nga pipala yo lagi ko ningi kayo lagi ko nilo asingin nilo ka igabe kaksi mayo ta magkopiyit sa kautingit at winangin na hulog ita makunung kanaya kaya kalakit to no pilawak to mi anya bealom mi kanaya nautin nago ikakagin ni surlo ang sabi mi ta ko kingo bagay taw hatta ko naginok kita ko nagilo.